Organization has warned that the new COVID-19 Omicron variant is spreading faster than any previous strain and that it is probably present in most countries of the world. But how different is this variant from others that have been reported in the past? Our senior reporter Sharon Baranga explains.
In the recent days, Kenya and the world received news of a new COVID-19 variant that was detected in South Africa, known as Omicron variant. The variant is spreading fast and a number of countries report to having cases of it, which has been raising questions as to how the variant is likely to affect the health of people and how severe is it.
The effect of the spread is that if one has been vaccinated, the level of attack is a lot less and the need for hospitalization is limited. So if one has been vaccinated, they are getting chills, a bit of headaches and so on. But so far, what we have seen ourselves and what we have heard from our colleagues from South Africa and elsewhere is that the level of hospitalization is less than the Delta variant that we had some time back.
Omicron variant symptoms to look out for are tiredness and muscle aches, scratchy throat, dry cough, high temperature, high pulse rate, headache, breathing difficulties, and loss or change of smell and taste. The World Health Organization has warned the new COVID-19 Omicron variant is spreading faster than any previous strain, and it is probably present in most countries of the world.
Vaccines alone will not get any country out of this crisis. Countries can and must prevent the spread of Omicron with measures that work today. It's not vaccines instead of masks. It's not vaccines instead of distancing. It's not vaccines instead of ventilation or hand hygiene. Do it all. Do it consistently. Do it well.
WHO is worried that countries are dismissing Omicron as a mild variant. Though Omicron is more contagious, it is not yet clear whether the strain causes more mild or severe disease than past variants of the virus. WHO further warned that vaccines alone will not protect countries from Omicron, emphasizing the importance of masks and social distancing. The Omicron variant significantly reduces the protection against infection provided by Pfizer and Biotech's 2-dose vaccine, according to preliminary lab data released by the companies last week. Scientists at the University of Oxford published a study on Monday that also found the Pfizer and AstraZeneca vaccines are less effective against Omicron. In continuation to the scientific discussions on COVID-19 vaccines research, WHO is organizing a consultation to review emerging data related to the Omicron variant. During this consultation, global experts will review the available evidence, critically appraise the data, and summarize the interpretation of evidence and next steps.
The Omicron variant is likely to be the dominant variant, not just in our country, but across the world. And we are happy that the management of the variant globally is now being handled in a better way. We have had some countries that, for example, had closed and locked out people traveling from some countries have been removed from the red lists, and that's a good plan because the way to manage the virus is to ensure that we keep away the virus, but not necessarily keep away people. This variant is there with us. It is going to spread, there is no question about it, and it's a question of us preparing ourselves. We have urged that through the COG that all counties begin serious preparation for any eventuality.
Since the first case of COVID-19 in the world was reported in Wuhan, China, the world has been dealing with a number of variants. The Ministry of Health says a majority of patients currently receiving treatment are infected with the Delta variant. Sharon Baranga, TV 47.